Welcome to Love Bites. Love Bites. Love Bites. Love Bites. By Dr. Tara, your destination for sexual wellness and mindful relationship advice. Hope you're having an orgasmic day.
Hi, Love Bites fam. Welcome to my first segment of this show, which is In Bed with Dr. Tara, where I answer one or a couple of your questions that I get through my website. If you'd like to ask me a question, you can go to lovebits.co and click Ask. That's where you can leave your name, email, and you can use a fake name, of course, if you want to, and ask me a question. Let's get started. Today, the first question is from Jason. Dr. Tara, I have a hard job and I want to know how many times I have to masturbate in a day to feel less stressed since my girlfriend doesn't want to have sex with me all the time. First off, sorry to hear that you have a really hard job. Many things you can do to reduce stress apart from masturbation, but no shame in the masturbation game. I would say daily masturbation is healthy. Other things that you can do to reduce stress is also taking a bath or a long hot shower, watch a short episode of a funny TV show, do meditation and breath work, eat really yummy food. Another thing with your girlfriend that you can do that will also reduce stress is cuddling. Research shows that cuddling produces oxytocin and releases serotonin, all feel-good hormones. So that's great too. Now, your girlfriend doesn't want to have sex with you all the time. That's okay because people have different sexual desires level. It's all about communicating with each other if you are sexually dissatisfied in general. Let me ask you this. How satisfied are you right now from 1 to 10 with your sex life? If you're thinking 5 or less, it is time to have a radical change in your relationship in terms of what both of you can do to tune in towards each other more and have better sexual connections. So that's something to think about. Feel free to reach out for another question once you have that part figured out. In order to help your girlfriend feel more sexual and have higher desire is to also help her reduce her stress level. When she's not stressed, women tend to be more open to sexual connection and to sex in general. Reducing stress together would be great. The next question is from Norma, and Norma said, suggestion on sex toys to use during foreplay to help expand cervix. My kitty is always tight and too small for hubby to get even a finger in. It's hard for us to try and have a quickie because of this. Trying to find a vibrator, dildo, sex toy that can help expand my cervix. On days we just want a quickie so that we can enjoy sex quicker without any pain or tearing afterwards. 2 things. Number 1, if it's your choice to participate in quickies, that's awesome. But don't feel like you have to be pressured into quickies all the time. If you can plan more time for sex where he can go down on you, start playing with your clit, licking your clit, maybe using a vibrator on your clit, that would be great. But a really good tool in general for people with really tight vaginas is called a dilator. And there's a couple of companies out there that do dilators, and there's different sizes from a very small one, like a pinky finger, to a much bigger one. So you kind of graduate to that. When you use a dilator, make sure you put a lot of lube on it as you insert, and you would just start with the smallest one. One company that I know is Intimate, and they do pretty good dilators as well. So I would say try dilators and let me know how that goes. Your hormones definitely affect your sex life. So today, we're going to talk about it with a renowned authority of this topic. Hello, my loves. It's Dr. Tara, your favorite sex and relationship expert here at Love Bites, the podcast for sexual wellness and exploration. Today with us is Dr. Jolene Brighten, who is a pioneer in women's medicine and an award-winning board-certified naturopathic endocrinologist and certified sex counselor. She is the author of Beyond the Pill and Healing Your Body Naturally After Childbirth and Is This Normal? Dr. Brighten empowers women worldwide to take control of their health and their hormones. She is an international speaker, clinical educator, and medical advisor in the FemTech industry, and is considered, like I said, a leading authority on women's health. Hello, Dr. Brighten.
Hi there. I'm so excited to be chatting with you today and definitely your audience because you have some of the best people on the internet.
Thank you. They are very sex positive and very curious about all things that affect their sex life and just well being in general. So, hormones, what is it all about?
Well, what are we told, right? Is hormones are just the bane of our existence. They make women crazy. They make you feel awful. When in reality, your hormones give you literal superpowers. How your brain is able to form memories that you can fire across both lobes. And then not to mention all of the sexy stuff that helps you in the bedroom, helps you in your love life overall, and then energy to be able to accomplish all of the above.
What is this normal about? It's a perfect title because people, I bet, they will give you all kinds of situations and ask you, is this normal?
It is the question that from the moment we start becoming aware of our bodies, starting to notice differences that we start asking, is this normal? When we go through puberty, we want to know, is this normal? And then through the ages, what starts changing in our 20s, our 30s, certainly perimenopause, and throughout our life that we're left questioning, is this normal? And sex is certainly no exception. So the book is divided into 3 sections. The first section is your sexual self. So we go through what's normal about a vulva, what's normal about a vagina, what's normal about the clitoris, what's normal about orgasms, masturbation, libido. The second section, we get into what's normal when it comes to the menstrual cycle. So this is your cyclical self. We're talking about the menstrual cycle, your period, your breast. I actually put it in that category because they're cyclical in nature as well. And going through things like discharge. Is it normal that after I do it with a man that so much stuff is coming out of me? Yes, that is normal. And we've all done the awkward walk to the bathroom, but we just don't talk about those things. And then I marry it all together in a 28-day program. In the end, I'm taking you through your cycle week by week of what is changing, how you can support it with nutrition, lifestyle therapy, solving your hormonal issues, solving your acne and your sleep issues, and then understanding how sex can be different at each stage of your cycle and how that's normal because you're a cyclical creature.
Let's zoom in a little bit about how sex can be different on like different days in your cycle.
This usually happens in a heterosexual couple because the male partner just does not understand that hormones are cyclical and things change. And I think some of us have seen the meme where it's like, why is it women are so into us? And then the next day she's like, nah, like not at all. And that has to do with our hormonal changes. Whenever we talk about the menstrual cycle, and I certainly do this as well, we always come from that reproductive standpoint, you know, it's always like ovulation and period.
Yeah.
And yet researchers have said, like, we should actually name this phase of your cycle your sexual phase. This is going to be the peak of your sexual everything. So your clitoris will swell on command. You will find that you can self-lubricate like a champ in most instances. Orgasms, it's a done deal. Like if you just stimulate right, done deal. Probably finding yourself fantasizing more. Maybe you're scrolling TikTok and you're like, there's a stirring in my nether regions. Like what's happening there? And that's that sexual phase, which also gets classified as the ovulatory phase. So we're all taught about the cycle from the period being the starting place. It's actually the period is the fallout of a non-fertilized egg or a fertilized egg that didn't implant. The whole cycle starts with ovulation. Don't worry, y'all. We're going to get to the sexual phase. But first, I'm going to say we've got our period. That's how we all learn about the menstrual cycle. And for most people, it's going to be around 4 or 5 days. It could be a week, but that phase of the cycle, that's when vaginal secretions, even though the blood may be flowing, the rest of your juices are not flowing, so to speak. Self-lubricating can be a little more difficult. The threat of unwanted pregnancy, which is something that can be a major break for us, isn't there just before our period or when we early start our period. There's a lot of women who find that they are very aroused during their period. So they find that their tissues are swelling, they're more responsive. And
I'm very aroused on my period.
Is it normal that I want sex on my period? Yes, it's normal and it's actually good for you. It can help with cramps. It can help you get better sleep. And it certainly can be a time where you find that all of the chemicals that are released from an orgasm can help with those symptoms of feeling like icky, like that icky period feeling. It can help you feel more energized.
We all know it.
We all know it. We've all been there. I have yet to meet a person who's like, no, my periods have always been the easiest thing ever.
I'm like, I'm annoyed by you. If you're like, oh, it's so wonderful. I feel so wonderful. I'm like, just don't talk to me.
The shame has been passed down for generations of periods are something to be ashamed of. So period sex is certainly something to be ashamed of. It absolutely is not. So if you're having vaginal intercourse, it can provide an internal massage, but you don't even need that. You can just have clitoral stimulation. And that can release endorphins that help with the pain. And it may even help speed up the flow in terms of ending your period sooner. So there is some small amount of research that it might make your period a little bit shorter in a good way.
I'm loving this research.
After your period, we move into the later follicular phase. And that's the part where, okay, now we start to see that we're getting closer to the rise in estrogen and testosterone, which is going to be in that sexual, AKA ovulatory phase. So before that, you're in the follicular phase, your period has ended, you notice, oh, my breasts are less tender. So for this first part of your cycle, your breasts are less tender. But in the late follicular phase, the nipples start to get a little more sensitive. None of the tenderness of the luteal phase, which we'll get to, but the sensitivity to where nipple play is a great idea.
So right after the day your period ended, do some nipple play.
Absolutely. So this is a good time to try for a nipplegasm, a nipple-induced orgasm. Not everybody can hit it that way, but I'm always like, why not try? Lubrication is going to start picking up. But friends, as I say a million times in the book, lube is everybody's bestie, and a lube-free bedroom is where good sex goes to die. Always have lube on hand.
I love lube.
Who isn't a fan of a slip and slide, everybody? Like, come on. This is another area of shame where people are like, oh, well, if he was doing it right, then you wouldn't need lube. Or if she was the right one, she would self-lubricate. It actually doesn't work that way. One, we tend to be the most wet in that ovulatory or sexual phase. That's when we're the most wet. We can self-lubricate so well. As we get older, it may be more difficult, but it doesn't mean that there's anything wrong with your vagina. It's also something that the longer you've been in a relationship, it might be more difficult for you to self-lubricate at times. Whereas in the beginning, you were like, I was wet all the time. Yes, we were all in that phase at one point. It's like, we were all in that phase of, I'm always turned on, I'm thinking about sex all the time, and everything's fantastic. It's normal that it doesn't last forever. Now we moved out of that late follicular phase, and this is where we get to that sexual phase I was talking about. So everybody, we're not edging here. I'm going to give it to you. Here we go.
Yes, I love me a sexual phase. Tell us, doctor.
We have to know about LH, luteinizing hormone. This is a brain hormone that spikes and triggers the ovaries to release an egg. So this makes sense, primitively speaking, biologically speaking. We want to capture sperm and try to get pregnant. And I mean our body that has its own agenda, so whether or not you want to. So what we see is that 3 days leading up to the LH spike, and then the day of, and 2 days after, the clitoris is like, I am here for whatever you're bringing, friend. Like, I am all in right now. And from a biological perspective, it makes sense because sperm can live about 5 days. So you would be seeking out sex. You'd be wanting to have sex and capture sperm. Your body's here to make babies. It does. If you don't want to have a baby, you're like, sure. We're going to wear a condom. I have an IUD. We're going to do something different here. That is the phase where we'll see that libido can be really up. Things that normally are turn-offs or hit our brakes or stressors, they tend to affect us less because we've got testosterone and estrogen really working for us. Once you ovulate, what's left in the ovaries is the corpus luteum. So the only way to progesterone is via ovulation. And that is a bit of a cock block, so to speak. It's amazing because it's going to help you be more articulate. So you might be more verbal, which is great. Like, this is a good time to communicate your needs to your partner. This is a great time maybe even to have that sexy talk. When you look at the research, most people talking dirty to them does it for them.
Love me dirty talk. Asking for the people who have told me that they consistently have low libido. So the sexual phase for women, if they have low libido, is it normal?
Is it low relative to your normal, or are you comparing it to other people? Because that's usually the trap people fall into, is that they're like, well, compared to my friend, compared to my partner, my libido is low. Why is it different? Why is your menstrual cycle different? Why is your period different? Why is your resting heart rate different? There are biological differences. And so it doesn't mean that something is wrong with you, but you may be gauging it based off of other people's normal and needing to reframe and look at what's your baseline been? Because if your baseline has been consistently, I'm not somebody who's walking around thinking about sex. My partner starts to stir it up. I'm like, meh, take it or leave it. If you're that kind of person, I like to say you got to get things going before things get going. There's nothing wrong with you. It's that you're not that stereotypical archetype of what we see portrayed so often in the media, which is he just gave you a look. Now you're wet. The panties come off. You're orgasming. That's just like not reality for a lot of people. Even when you're just really turned on by this person, it's just much more complex. We've got our nervous system has to be lined up. We have to feel safe and secure. It matters where our hormones are at in our cycles. We see this, they meet, they're making out, instant chemistry. That can happen. That's normal. That can also be completely outside of your norm where you've never experienced that. And it doesn't mean anything is wrong with you. Normal is a spectrum, and we need to figure out your normal, because once you know that, you can embrace it, you can work with it, you can get the pleasure you want, and you can also know when it's not normal so that you can see your provider, you can get help around that.
So when it comes to, let's say, wetness, what if a woman can't get wet in any circumstances? Is that normal?
There is what we know documented in the research, arousal non-concordance. So this can happen. I'm like, your brain is sending your genitals the memo and they're just like off in their own land. They haven't get the memo yet. That can be normal. And that's a great time to use lube. I had a patient say, one time I was scrolling TikTok, she's like, I'm heterosexual, but I saw this woman and suddenly I was wet. I felt, engorgement. I felt the changes. What is going on there? Your brain just interpreted sex. Oh, that's sex. Let's go. And then you get to decide. And that's what matters at the end of the day. Are you consenting from the brain level, not from the genital level? And so things may be dry because of arousal non-concordance, or it may be where you're at in your cycles. It also can be dry because maybe you're on oral contraceptives. Those can lead to vaginal dryness. That's not a you issue. That's a you blocking baby issue. And it's working really well to block a baby. We can acknowledge that. But it also could be a sign that your estrogen is too low. So this can happen postmenopausal. So after you stop menstruating for a year, then you're postmenopausal. That can be a sign of low estrogen because of that. It could be primary ovarian insufficiency. You could have an issue with functional hypothalamic amenorrhea. In all of these, the period goes missing. The vagina becomes very dry because estrogen, it helps the cells that feed the lactobacilli in your vagina, helping keep the right pH and also keeping the cells plump and so they can self-lubricate. This should not be ignored. So your doctor might be like, just get a vaginal moisturizer, just get a lube. No, if you're having that kind of vaginal dryness, because it can progress to where you can't urinate and wipe with tissue, or you get bleeding, or you can't even walk because the tissue is so dry and painful. Yet, whoa is right. That kind of dryness can lead to vaginal atrophy. We can get clitoral atrophy. So that means shrinking. We don't want that. The vagina can become tight, painful. Now we've got pain with sex. And there is this like archaic dogma in medicine where pleasure is a backseat in a woman's life, and they're not sexual creatures anyways. Sorry, we have a clitoris that serves only one purpose, and you're going to spin this dogma of women just don't really like sex anyways. No, they like sex. They just like it a certain way. You just have to ask them.
Absolutely love sex. I get a lot of hormonal bloating, which at first I just thought regular bloating. And then I realized a lot of it is hormonal bloating. What is it and how should we deal with it?
A major cause of bloating that often gets overlooked is progesterone rising in the luteal phase can actually relax your intestines so that they're not moving as much. And anything that's going to sit in the large intestine, your food's getting digested, but it's sitting in your large intestine, you can start to get gas and bloating. This is where people will say, where does all the poop come when my period happens? Why am I pooping so much? Did I just store up a month of food? And it can be because progesterone relaxed your intestines. Now that the progesterone has dropped and prostaglandins come up, which are going to contract your uterus, they also contract the bowels. It's sometimes why people get period diarrhea. That can then relieve things. So once the period comes a day or two in, the bloating can decrease. And drinking plenty of fluid, making sure you're moving, and making sure you're getting 25 grams of fiber. That's a general recommendation that we all want to be doing for bowel health. But in addition to that, it might be something adding a little bit of magnesium citrate. There's calm magnesium. You can get a little bit of that. I always say start slow, and that can help your bowels get to moving because that type of magnesium actually pulls water in and will help you pass stools. And then other times it can be bloating is an issue because of water retention. And so we're getting imbalances in our estrogen and progesterone, and that's causing electrolyte imbalances. And now we're feeling just puffy and swollen.
In terms of women's bodies before, if they're looking to get pregnant, during and after, of course, there's like a ton of hormonal changes. What are your 3 biggest tips for women that want to go through that process?
The first tip is to recognize that trying to get pregnant, this is something that never gets talked about. And that is the pressure to have sex makes you not want to have sex. A lot of people, the sexpectation is there. You're like, no, that's a turnoff. I'm not into it. And so a lot of couples will find that they're supposed to time sex. You have to time it. But that kind of calendar, that kind of pressure, that can make it really hard to get in the mood. And acknowledging that, having that conversation with your partner, that's a good time. If you don't have kids already, book a hotel room, maybe try role playing, get some lingerie, do some things that are going to maybe take you a little bit out of your comfort zone because it's going to spice things up and make it more interesting so that you're not so focused on the goal is that we're supposed to mechanically just have a baby. That's a really big issue that people run into. Everybody's talking about how to try to conceive and they're like cervical mucus and look at this and look at that. But like nobody's talking about like you got to want to have sex in order to get pregnant. During pregnancy, that is a time where your libido may go down. It may skyrocket. I mean, not a lot of people talk about it, but they talk about it behind closed doors. Their libido skyrockets. You have tons of hormones. You also have tons of blood flow down to your clitoris, your labia, your vagina. You'll self-lubricate a lot easier just by way of how much blood flow is there. Sex is good for you. So unless you have a medical condition where your provider's like, you can't have any kind of penetration, even then you can still usually have oral sex, or you can use a toy to stimulate the clitoris or manually stimulate the clitoris. There's still things that you can do. A lot of women get shocked by how their libido is up, and that sex is actually great. So orgasms help with toning the pelvic floor. It also helps you get present in that area. There's all these meditation and mindfulness gurus, and I'm like, y'all just work towards orgasms because I'm telling you that is the most solid act of mindfulness right there. And it's fun.
I would agree.
And the dopamine reward is very good. It's like, do that again. So
yeah,
sex in pregnancy can be great. Also keeping up the circulation in the pelvic floor, all of that can be fantastic. And it's a good time to start experimenting with new positions. Couples, sometimes they just have their go-to position. As your belly gets bigger, as your hips expand, as your butt gets creative. You've got to change positions. Putting a pillow under your hips anytime is a great way to expose your clitoris, to position yourself for vaginal penetration. And as you go through pregnancy, you may find that you need to do a sideline position and get pillows between your legs. It's so interesting to me how many times patients are like, do you mean sex positions I experienced in pregnancy that I'm like, this is where it's at, that they wouldn't have done anyway. So give yourself permission to try things out. Because sometimes we see in the movies and stuff where it's like, oh, we can't have sex anymore because like she's too heavy or this is like, that's all BS. That's all
I
BS.
believe
It's
so.
not. And
I'm so excited. I can't wait to have pregnant sex in the future. Very excited. So my Love Bites fam, I'll be back to report on my pregnant sex situation.
Yeah, I do have to say that like my husband, in my last pregnancy, he was like, I can't keep having sex every day. He's like, and multiple times a day you're coming to me. And I'm like, I don't know. But my body is like, it's like, just turn to the vibrator and give me like a moment, like here.
Yeah.
So it is really a common time to see that libido is up. And you have all these aches and pains and even headaches sometimes in pregnancy, like the go-to, oh, not tonight, honey, because I have a headache. It actually could relieve a headache. It also can help with aches and pains because of those endorphins that get released. And as it's releasing endorphins and oxytocin, that's blocking cortisol, which for the long term of your baby's health for their lifetime, having those lower cortisol levels is going to benefit them. It's going to make them more resilient in their lifetime distress. You're also taking care of baby by taking care of yourself.
Yes, we're aiming for happy babies.
Yes, absolutely.
Postpartum, let's talk about that because that is an issue where millions and millions of people experience.
Yes. So postpartum is a common time to have pain with sex, but you should never accept that as normal. This is something where doctors will often say, you just had a baby. It's normal that you have pain. No, it is not. It is common that you have pain, but you need to figure out why you have pain because something else could be going on. And often doctors are like, just use lube. Okay, sometimes that's where it's at. And especially postpartum, your estrogen is going to be down. So it's a drier time. Vaginal sex, we're going to start with pain with sex because 1 in 3 women experience this and it's not normal and it is very much ignored. And so if you are postpartum and you're finding it's not pleasurable, it's just painful, meet with a pelvic floor physical therapist, meet with somebody who specializes in rehabbing that area postpartum, because not only can it make it so you have better sex, but you also will be less inclined to pee yourself. And who doesn't love that?
Love that. How are hormones connected to low sexual desire?
Now, the number one everyone jumps to is testosterone because, yes, it's absolutely associated with sexual desire. However, it's not always a testosterone issue for people. So it's important to keep in mind that testosterone is important. If you're on hormonal birth control or if you're postmenopausal, testosterone can definitely be an issue. But what often gets forgotten is cortisol and what's going on with your stress. That is an area, it's not sexy. We just want to give testosterone. It'll be sexy time.
Yeah.
And we don't want to talk about the fact that you have to deal with your stress. Like your body doesn't understand. Is your boss yelling at you or is a tiger yelling at you? One will definitely kill you. The other will not, but your body doesn't know the difference. And so if you keep finding yourself repeatedly in that fight or flight mode, you're finding that you're stressed a lot. You're not getting good sleep. Your blood sugar is imbalanced because you're, just pounding coffee all day and not eating in a way that really supports your metabolism. That can negatively impact your sexual desire because when your partner or the sexy signals in your environment come in, your brain can't hear that. There's too much static and too much noise. And it's almost like the sex signal is trying to yell over it and your brain's like too loud, too much, not here for it, need to survive. Looking at how you can reduce your stress levels and how you can support your body to know that it's safe will open up the nervous system so that when sex is presented in the way that you like it, whatever way that is, your brain can receive the signal and then tell the rest of the body, hey, we're going to stop everything and we're going to get down now.
Ooh, love that. What's your favorite way to reduce cortisol?
Oh, sleep. So tending to your circadian rhythm is super, super easy. It just takes us actually doing it. First thing in the morning when you wake up, exposing yourself to light is going to help your cortisol come up in the morning. That is when it should be up. Then it should come down in the evening. Now, to make sure that it goes down, we want to sleep in a cool room. We want to make it super dark and we want to avoid screens. And look, if you're on social media at night, I'm not judging you for that. Can you put on some glasses that block the blue light and make a bit of a bedtime routine for yourself so that you can wind down? And if you need extra support, if you are someone that's like, I'm wired, even though I'm tired, something like phosphatidylserine is it's an amino acid that can help bring down cortisol levels. But what this whole circadian training is doing is it's training your cortisol to come up when it should and then come down at night so that melatonin can rise and you can get that restorative sleep.
Love that. Sleeping tips. Can dancing reduce cortisol?
Oh, absolutely. Singing out loud, doesn't matter how bad you are, your body doesn't know it. It stimulates the vagus nerve, and the vagus nerve innervates your brain, your heart, and your gut, and even all the way down to your pelvis. It's a nice way to stimulate that nerve and help the nervous system move into that rest and digest aspect. Mindfulness, as we talked about, like being mindful with sex is actually a stress reduction practice. And then you can look at things like doing deep breathing. First thing when you wake up, don't check social media, take some breaths. And emphasize the exhale. Make the exhale a little bit longer, and that pushes you into that rest and digest state. That calmer state is what the tone will be for your day, which means that as stressors come up, your nervous system's default is we chill. We want to be there.
Oh, I love that. I want my default to be like, I'm chill. We're chill. We're good. Thank you so much for dropping all the truth bombs. And I feel like I've learned a lot, especially about hormones and the body and the cycle. I also really love the term sexual phase. So I'm going to start using it, saying it's from the episode with Dr. Jolene Brighten. The last segment of my show is called 10 Quickies with Dr. Tara. So I'm going to give you a word and you just have to give me a response back. Are you ready,
Okay.
Dr. Brighten?
I am not ready, but I'm here for it all the same.
What was the saying that you say? You gotta get going to get it going?
Yeah, get it going. Let's
Yes.
do it.
Let's do it. Number 1, clitoris.
Fun.
Yes. Number 2, dry vagina.
Sad.
Number 3, motherhood.
Fun as well.
Number 4, squirting.
Oh, exciting.
Number 5, sexless marriages.
If it works for you.
Number 6, birth control.
Everybody's got to do what they got to do.
Number 7, sex drive.
Sexual desire.
Number 8, vibrators.
Oh, is that my answer? Giggles,
Love it.
Joy, excitement.
Like a fountain.
Yes, the squirting.
Number 9, tantric sex.
Oh, exciting.
And last but not least, number 10, hormones.
Oh, superpowers.
Superpowers. I love that. And on the good note, right? Where can people find you?
My main hub is drbrighten.com, drbrighten.com. And then you can also find me on TikTok, YouTube, and Instagram at drjolene Brighten.
I'll make sure that all the links is in the show notes, my love. Thank you so much, Dr. Brighten, for joining us today and educating us. And thank you, my Love Bites fam, for listening till the end of the episode. You know how much that means to me. Love you guys so much and have an orgasmic day.
Yeah.
Thanks for listening. This was Love Bites. Love Bites. By Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.